You want the truth, fine. Daily masturbation in the prostate. Let's get into it. No blushing, just facts. Your prostate is a walnut-sized gland that sits just below the bladder and helps produce semen. As men age, that gland often becomes inflamed or enlarged, what we call prostatitis or benign prostatic hyperplasia. And guess what? Ejaculation has something to do with how well your prostate behaves over time. When you masturbate, you're not just scratching an itch. You're flushing out the pipes. Regular ejaculation clears out old seminal fluid, reduces congestion, and improves circulation. Several studies show that men who ejaculate more frequently, yes, even daily, have a lower risk of developing prostate cancer. We're talking about a 20–30% lower risk in some research. That's not junk science, that's epidemiology. Now, don't misinterpret this as a prescription for 247 self-love. Balance matters. If it disrupts your sleep, relationships, or productivity, that's a problem. But if we're strictly talking prostate health, frequent ejaculation is beneficial. It's a release valve. It keeps things moving. Think of it like oiling a machine. You don't let it sit and rust. You keep it functional, and no, it doesn't deplete testosterone. That's a myth. In fact, your body recovers hormonal balance rapidly post-ejaculation. You won't run out of anything. What's more likely to wreck your prostate is a sedentary lifestyle, poor diet, or ignoring symptoms when something feels off. Bottom line, if you're healthy, not compulsive, and not neglecting real-world intimacy, then daily masturbation isn't harmful. On the contrary, it might be one of the simplest, most natural forms of preventive care you've got. And you don't even need a prescription. The prostate is a small gland with a big job. Located just below the bladder and surrounding the urethra, it plays a critical role in producing seminal fluid, which nourishes and transports sperm. Like any organ in the body, it performs best when it's functioning regularly and not allowed to stagnate. This is where regular ejaculation comes into play. Specifically, the idea that frequent release, whether through sexual activity or masturbation, helps maintain the prostate's internal environment. During ejaculation, the prostate contracts and expels seminal fluid, effectively clearing out the system. Without regular ejaculation, some research suggests that the fluids can build up, potentially leading to blockages, inflammation, or the accumulation of cellular debris. Think of it like plumbing. If the pipes aren't flushed now and then, buildup occurs. Over time, this can contribute to discomfort, swelling, or even infection. In some men, this leads to a condition called prostatitis, an inflammation of the prostate that can cause painful urination, pelvic pressure, or even chronic pain. On a cellular level, stagnation within the prostate might create an environment more conducive to abnormal cell growth. Some researchers propose that regular ejaculation may help reduce oxidative stress or lower the accumulation of carcinogenic substances within the prostatic ducts. By regularly emptying the gland, you're helping to refresh the system and promote a healthier cellular turnover. This is one of the proposed mechanisms behind the observed correlation between frequent ejaculation and reduced prostate cancer risk in several long-term studies. Beyond cancer prevention, the benefits of regular ejaculation also extend to improved circulation within the pelvic area. Ejaculation stimulates blood flow, which can enhance oxygenation and nutrient delivery to the prostate and surrounding tissues. Better circulation supports tissue repair and immune function, reducing the risk of infection or cellular damage over time. Additionally, many urologists agree that men who experience irregular sexual release report fewer symptoms of prostate-related conditions such as benign prostatic hyperplasia and BPH. BPH is a common condition in older men, characterized by prostate enlargement that leads to urinary frequency, urgency, and weak flow. While ejaculation isn't a cure, it may help alleviate some pressure or discomfort associated with this enlargement, especially in the early stages. The prostate is a small gland with a big job. Located just below the bladder and surrounding the urethra, it plays a critical role in producing seminal fluid, which nourishes and transports sperm. Like any organ in the body, it performs best when it's functioning regularly and not allowed to stagnate. This is where regular ejaculation comes into play. Specifically, the idea that frequent release, whether through sexual activity or masturbation, helps maintain the prostate's internal environment. During ejaculation, it's also important to recognize that ejaculation is a natural physiological function. It's not something foreign or excessive. When done in moderation and without compulsion, it aligns with the body's natural rhythm. From puberty onward, The male reproductive system is designed for regular release. Ignoring this aspect of biological maintenance can, over time, contribute to dysfunction. That doesn't mean every man needs to ejaculate daily, but consistent, routine release seems to offer benefits, not just mentally or hormonally, but directly to the health of the prostate itself. So when considering long-term prostate health, regular ejaculation emerges as a surprisingly simple and natural method of self-care. It costs nothing, requires no medications, and involves no invasive procedures. Yet it supports the body's natural systems in maintaining balance, circulation, and function. There is a growing body of scientific evidence suggesting that frequent ejaculation, whether through sexual intercourse or masturbation, may be linked to a reduced risk of prostate cancer. This isn't just a hunch or folk wisdom, it's rooted in several large-scale, peer-reviewed epidemiological studies that have tracked the health habits and outcomes of thousands of men over many years. One of the most referenced studies, published in the journal European Urology, followed nearly 32,000 men over an 18-year period. The data revealed that men who ejaculated 21 times or more a month had a significantly lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times per month. Why would ejaculation frequency affect cancer risk? The mechanism is still being studied, but there are several strong hypotheses. One centers on the idea of cellular turnover and the removal of potential carcinogens. The prostate produces fluid that can accumulate over time. Without regular flushing of this fluid, waste products and inflammatory agents may build up inside the gland. Chronic inflammation is a well-documented contributor to various forms of cancer, including prostate cancer. Regular ejaculation appears to reduce this buildup and may help keep the internal environment of the prostate cleaner and more stable. Another theory involves hormonal balance. Testosterone and other androgens play a role in both sexual function and prostate growth. While ejaculation does not reduce testosterone levels in a harmful way, it may help regulate the hormonal environment inside the gland. That hormonal balance could be part of why regular sexual activity appears protective. Some studies also suggest that frequent ejaculation may help regulate the expression of certain genes related to cell division and apoptosis, programmed cell death, both of which are crucial in preventing the uncontrolled cell growth that defines cancer. Additionally, lifestyle factors tend to overlap with this kind of sexual behavior. Men who maintain active sex lives or engage in regular masturbation often have lower stress levels, healthier cardiovascular function, and better overall physical activity patterns. Stress itself is known to contribute to immune suppression and chronic inflammation, two important factors in cancer development. It's difficult to separate these variables completely, but even when controlled for other health behaviors, the data still suggests a direct benefit to regular ejaculation on prostate health. It's also worth noting that the benefits were most clearly seen in men who had consistent ejaculation patterns throughout their adult lives, particularly from their 20s through their 50s. This implies that it's not just late life activity that counts. Maintaining a healthy sexual function earlier in life could provide long-term protective effects. Importantly, ejaculation frequency doesn't need to be excessive. The protective range begins around 13 to 1 times per month, or roughly every other day, which is well within the range of normal sexual behavior for many men. Ultimately, while more research is needed to pinpoint all the biological mechanisms involved, the correlation is strong and consistent. Frequent ejaculation is associated with a reduced risk of prostate cancer, making it a simple, natural, and accessible part of preventive health for men. A common myth that continues to circulate in conversations around sexual health is the idea that masturbation, or frequent ejaculation in general, somehow drains the body of testosterone or damages hormonal balance over time. This belief is not only outdated, it's scientifically inaccurate. The reality is that ejaculation has a minimal and temporary impact on testosterone levels, and regular sexual activity or masturbation does not lead to any kind of hormonal deficiency in healthy men. Testosterone is produced primarily in the testes and regulated by a complex feedback system involving the brain, particularly the hypothalamus and pituitary gland. This system is designed to maintain stable levels of testosterone in the bloodstream, regardless of fluctuations in sexual activity. After ejaculation, there may be a very slight, short-term dip in testosterone, but this is transient and fully recovers within hours. There is no evidence to support the idea that regular masturbation causes a long-term decrease in testosterone or impairs the body's ability to produce it. In fact, in some cases, regular sexual activity may actually help support hormonal balance. For example, maintaining an active sex life has been associated with healthier levels of testosterone, especially in aging men. Studies have shown that sexual activity can stimulate the production of hormones like dopamine and oxytocin, which contribute to improved mood, motivation, and even endocrine function. Testosterone itself is also responsive to mental and emotional states. Confidence, intimacy, and physical health all play a role in regulating levels. So when a man is sexually active, even through solo activity, it can reinforce positive hormonal signaling pathways in the body. Another related myth is that frequent ejaculation leads to fatigue or physical weakness due to hormone depletion. While it's true that sexual activity consumes energy, the impact is comparable to moderate physical activity, nothing extreme or damaging. The body is remarkably efficient at restoring its hormonal and metabolic balance quickly after sexual release. Testosterone is not a finite resource that runs out with use. It's continuously produced and regulated based on need and biological feedback. It's also important to differentiate between compulsive behavior and healthy sexual expression. When masturbation becomes excessive to the point where it interferes with daily responsibilities or relationships, the problem isn't hormonal depletion. It's behavioral imbalance. That scenario is psychological and social in nature, not endocrinological. But when practiced in moderation and within the bounds of a healthy lifestyle, masturbation does not impair hormone levels in any meaningful way. In reality, the fear of losing testosterone through ejaculation often reflects cultural or psychological discomfort with sexuality rather than any scientific truth. Misinformation like this can lead to unnecessary guilt, stress, or avoidance of a completely natural bodily function. The science is clear. Regular ejaculation through masturbation or partnered sex does not damage testosterone production. If anything, maintaining a healthy sexual rhythm may be one of the ways to keep the body's hormonal system functioning optimally over time. When it comes to prostate health, it's important to look beyond sexual activity and focus on the broader lifestyle factors that have a much more significant impact. While some people fixate on myths surrounding masturbation, the actual threats to prostate function are rooted in everyday habits, especially those related to diet, physical activity, and medical neglect. The truth is that a poor lifestyle does far more damage to the prostate than regular ejaculation ever could. One of the most prominent risk factors is a sedentary lifestyle. Physical inactivity slows down circulation, weakens the immune system, and contributes to systemic inflammation, all of which affect the prostate. Men who sit for long hours without regular movement may experience poor pelvic circulation, which can lead to congestion in the prostate gland. This can increase the risk of chronic prostatitis or contribute to the progression of benign prostatic hyperplasia (BPH), a condition where the prostate becomes enlarged and can interfere with urination. On the other hand, regular exercise, especially aerobic and pelvic floor-focused movements, has been shown to improve prostate function and reduce the likelihood of inflammation. Diet is another major factor. High intake of red meat, processed foods, and saturated fats has been linked to a greater risk of prostate cancer and general prostate dysfunction. Diets low in vegetables, fiber, and healthy fats deprive the body of critical nutrients and antioxidants that help neutralize cellular damage. A balanced diet rich in cruciferous vegetables like broccoli and cauliflower, tomatoes, which contain lycopene, and omega-3 fatty acids has been associated with improved prostate health and a lower cancer risk. What you eat consistently over years has a cumulative effect on the health of your glands, including the prostate. Stress also plays a surprisingly strong role. Chronic stress contributes to hormone imbalances and can trigger muscle tension in the pelvic area, which may aggravate symptoms of prostatitis or lead to discomfort during urination or ejaculation. Prolonged stress suppresses immune function and can create a hormonal environment that's more favorable to disease progression. Poor sleep, alcohol abuse, and lack of hydration often accompany high-stress lifestyles, compounding the risk. All these elements silently affect the prostate over time. Equally dangerous is ignoring early signs of prostate issues. Many men avoid seeing a doctor out of embarrassment or fear, which leads to late diagnosis of conditions that could have been managed effectively if caught earlier. Symptoms like frequent urination at night, weak urine flow, or pelvic discomfort should never be ignored. Early detection and preventive screening, such as PSA, prostate-specific antigen testing, or digital rectal exams, can make a life-saving difference, particularly for men over 40 or those with a family history of prostate problems. In summary, the real threats to the prostate come from lifestyle choices, inactivity, poor nutrition, chronic stress, and avoiding medical attention. While debates around masturbation often dominate public discussion, they distract from the more pressing, evidence-backed issues that determine long-term prostate health. Addressing these foundational factors is far more critical than worrying about how often a man ejaculates. Masturbation, like most physiological behaviors, follows the principle of balance. While the act itself is natural and, in many cases, beneficial for male sexual and prostate health, the context in which it occurs matters significantly. Daily masturbation, when practiced in a balanced and mindful way, poses no harm to the prostate or general well-being. In fact, as discussed earlier, it may support prostate function and lower cancer risk. However, when the behavior crosses into compulsive territory or begins interfering with other areas of life, such as relationships, responsibilities, sleep, or mental health, it becomes less about physical health and more about behavioral regulation. For many men, daily masturbation is a normal part of sexual routine. The body's reproductive system is built for regular release, and as long as this need is being met in a way that doesn't cause distress or dysfunction, there's no inherent harm. The problem arises when masturbation is used as a coping mechanism for emotional issues, loneliness, anxiety, or boredom. In those cases, the act may become excessive, not because of physical damage, but because it displaces more meaningful emotional or social experiences. In such scenarios, the harm is psychological, not physiological. It's also important to recognize the difference between frequency and intention. A man may masturbate daily and still maintain strong relationships, high productivity, and good physical health. Another man might engage in the same behavior but feel guilt, shame, or social withdrawal. Frequency alone doesn't define whether a habit is healthy. Its impact on one's quality of life does. If daily masturbation becomes the primary or only source of sexual expression, and intimacy with a partner is absent or neglected, that can lead to deeper dissatisfaction and potentially impact mental and emotional health over time. There's also a cultural and psychological layer to this. Many men are conditioned to feel shame around masturbation, especially if it becomes a frequent habit. This shame can amplify stress, which ironically undermines the very health masturbation could be supporting, like prostate function and hormonal balance. When shame is removed and the act is viewed through a health-focused, balanced lens, the benefits are easier to appreciate without unnecessary guilt. Physiologically, the male body is capable of handling daily ejaculation without damage. Sperm regeneration is continuous, and the prostate does not suffer from regular release. In fact, as discussed, it may benefit. The problem is not frequency, but compulsion and context. Masturbation should exist as part of a broader lifestyle that includes good diet, exercise, emotional connection, and meaningful relationships. It should not replace those things. Ultimately, masturbation becomes an issue only when it overshadows the rest of a man's life or leads to avoidance of real-life experiences. When done with awareness, daily masturbation is not only harmless, it can be a sign of a healthy, functioning sexual system. The key lies in how it fits into the broader picture of a man's life, health, and relationship. When it comes to prostate health, it's time to separate science from stigma. Regular ejaculation, including through daily masturbation, is not only safe, it may actually be beneficial. It helps maintain a cleaner internal environment in the prostate, reduces inflammation, and is linked to a lower risk of prostate cancer. Despite long-standing myths, there is no evidence that it depletes testosterone or harms hormonal balance. The real threats to the prostate lie in poor lifestyle choices and activity, unhealthy diets, unmanaged stress, and neglecting medical care. When practiced in moderation and without compulsion, masturbation can be part of a healthy, balanced life. Not a problem to fix, but a function to understand. Take care of your body. Stay informed and stop feeling guilty for something that's both natural and beneficial. That's the truth, no drama, just biology.